Hi, welcome to this edition of What's Happening at Tri-City Medical Center. I'm John Bonosoro, and I'll be your host for this program, which is a collaboration between KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local medical center, and to provide you with information for a healthy lifestyle. The topic for this show is heart health. Cardiovascular disease is the single biggest cause of death worldwide for both men and women. In 2010, cardiovascular disease caused about 16 million deaths in the world, which accounts for approximately 30% of all deaths. In the United States alone, about 610,000 people die of heart disease every year. With us today is Dr. Samani, and she'll talk to us about this very important issue. Dr. Samani is board certified in adult echocardiography, nuclear cardiology, and is highly trained in heart catheterization, coronary angiography, and pacemaker insertion. Dr. Samani works at North Coast Cardiology in Oceanside and is a staff physician at Tri-City Medical Center. Doctor, thanks for joining us today.
Thank you so much for having me, John.
Well, it's great to have you here, and let's start with the basic question.
Sure.
What's the definition of a healthy heart?
You know, the heart is like a hollow organ which keeps pumping blood throughout the body. Heart has, I always say, tell my patients that heart is like a house. It has its plumbing system and the pipes. And these pipes in the heart called coronary arteries. These coronary arteries are very small, tiny arteries that give blood and oxygen to the heart muscle. A healthy heart is a heart with clean coronary arteries, meaning that without any fat, cholesterol, or any other material inside the coronary arteries. Also, heart has its own electrical system. A healthy heart is a heart that beats regularly almost one beat every second. So in order to have a healthy heart, we need to have a healthy electrical system inside the heart. Heart also has different sections, and each sections are connected to other sections with doors, which we call them valve. A healthy heart has its healthy doors that they open and close properly. So a healthy heart is a combination of all these systems that they need to work together properly.
So how can we have a healthy heart?
A healthy heart comes from healthy lifestyle, and in order to have a healthy lifestyle, we need to minimize the major cardiovascular risk factors.
What are those factors?
Actually, there are 10 major cardiovascular risk factors that are known to cause cardiovascular disease, which I go over them briefly. One is age. So cardiovascular
Well, that's
disease,
the one we can't do too much about.
That's true. The prevalence of cardiovascular disease, unfortunately, increases by age, and that's the reason that we see more cardiovascular disease in elderly population. The second thing is physical inactivities. So if we do not have regular exercise, the prevalence of cardiovascular disease would increase. The other thing is obesity, and unfortunately the incidence of obesity is increasing in US, and US is already the most obese nation on earth. 4 is healthy diet. With having a healthy diet, we can definitely decrease the cardiovascular risk factors or disease, and that means having less carb or trans-saturated fat. The other risk factors are high blood pressure, which defines as having blood pressure of more than 120/80 millimeter mercury. High cholesterol is known to be a major risk factor for cardiovascular disease. High blood sugar, which defines as diabetes, is known to be a major risk factor for cardiovascular disease. And also smoking tobacco, like cigarette smoking, alcohol. The other thing is family history of heart disease. If anybody has relative, siblings, or parents with history of heart disease, that's going to be a major risk factor, especially in men below 55 and women below 65. If they have cardiovascular disease, it's a risk for other people in the family. And the last one is psychosocial stress, like job-related stress. These all 10 risk factors are known to be major clinical risk factors for cardiovascular disease.
So of the 10 risk factors, some, like age and of course your genetic background, aren't controllable. Some are controllable.
Exactly.
So what do you think are the most important behavioral changes that can help control the ones that we can do something about?
That's a very good question, actually. There are studies that done to see controlling which of these risk factors significantly can reduce cardiovascular disease. And it showed that 4 interventions or 4 changes in the lifestyle could significantly decrease the cardiovascular disease. One is physical activity, which shows having at least 150 minutes exercise in a week can reduce cardiovascular disease. 2 is losing weight. 3 is quit smoking or a smoking cessation. And then 4 is controlling blood pressure. And if we do all these 4, it actually lowers the risk of cardiovascular disease by 90%. And interestingly, only 3% of population, they do all 4. But usually in my practice, for my patients that they have some sort of cardiovascular disease, and to make it simple for them, I would go over the abbreviation of A, B, C, D, E. A stands for aspirin, or medication similar to aspirin. If the patient, they need to take aspirin based on their physician's recommendation, that stands for, that's the first thing. B is for blood pressure, or all the medications that can lower blood pressure. C, cholesterol, and also cholesterol and cigarette smoking, actually. D, diet or weight management, and also diabetes, and all the therapeutic options available to control diabetes. And E stands for exercise, which, as I said, meaning at least having 150 minutes of exercise in a week.
Well, probably the most controversial one of those is diet, because some of the other ones, I mean, smoking is obvious, either you do or you don't. We all have a diet. The question is what diet?
Right.
So what are some of the keys that you recommend for a heart-healthy diet?
That's exactly true. There are so many controversies about which diet is better, the low American fat diet or low carb diet. But in cardiovascular field, we recommend 2 diets or 2 dietary approaches which are known to reduce cardiovascular death. Mediterranean diet and DASH diet, which is DASH, stands for Dietary Approaches to Stop Hypertension. These 2 diets, basically, they have some key elements, meaning that few things to do more and few things to do less. The things that we need to do more is to eat more fruits, vegetables, olive oil, or basically a plant-based protein, which comes from legumes or beans. The things that we need to do less is to eat meat less, especially red meat, and kind of like replace it with poultry, light meat, such as chicken, fish, or turkey, and also have less like cookies, sugar, sweets, and also to have less amount of dairy, and also kind of like avoid sugary beverages and drinks. And if you just pay attention to these few tips, definitely you can prevent cardiovascular disease and morbidities. I always tell my patient to try to choose food mindfully, try to always pay attention to the labels of the food and read them, and also if they would like to lose weight, try to eat less calories, and of course try to cook at home and eat at home.
Doctor, we only have about a half a minute left, and we do have an important final question. What are the main symptoms of an unhealthy heart?
I would say there are different varieties of main clinical symptoms of the heart disease, but in general, any discomfort or heaviness, squeezing pressure in the chest, especially with exercise or activities, shortness of breath or difficulty with breathing, especially walking up hills. The other things are like feeling heart racing, skip beats, irregular heartbeats, and sometimes having pain or cramps in the legs, swelling, puffiness in the legs, and sometimes chronic fatigue, tiredness, or fainting or syncope or dizziness. They all can be clinical presentations of unhealthy heart.
Well, thanks for that great information. I know that was quick, but it's very important that we cover all of the elements. We appreciate Dr. Samani joining us today.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome to What's Happening at Tri-City Medical Center. Our guest today is Dr. Samani. Every year, about 750,000 Americans have a heart attack. During this show, we're going to talk about heart attacks and what can be done to prevent them from happening to you or a loved one. Welcome to the show, Dr. Samani.
Thank you so much for having me, John.
So let's start by saying, what is a heart attack?
So heart attack is a situation which happens to the heart because the heart starves for oxygen and blood. Heart is a pump and it needs its own supply of blood and energy. And inside the heart, there are some small arteries which are called coronary arteries. And these arteries carry blood and oxygen to the heart all the time. So if this artery becomes narrow from built up of cholesterol, fat, or other material, the blood flow to the heart muscle can be blocked. And the heart muscle starves for blood and oxygen, and they can get damaged or die. Basically, that situation, which is associated with chest discomfort or chest pain, is called heart attack or myocardial infarction.
So what are the warning signs?
Actually, unlike many movies, the common presentations of heart attack is not intense or severe many times. It can come on slowly. For example, any chest discomfort or pressure-like or feeling like a squeezing at the back of the chest bone, especially when it comes with exercise or activity, could be due to heart attack. Sometimes this pain is not necessarily at the back of the chest. It can be somewhere at jaw, shoulder, back, stomach, or even arm or forearm. There are some other clinical presentations of heart attack. For example, the chest pain, which is associated with nausea, vomiting, dizziness, sweating, or having calm or cold or kind of clammy skin. And sometimes heart attack can present itself with syncope or fainting. All these presentations can be due to heart attack.
You know, one of the things I heard you say, you phrased it a little differently than I've heard it before, and I think it's important. You talked about the back of the chest, and I've always had the question about, you know, what's a muscle pain from exercise or lifting weights or carrying boxes, and what's the heart attack pain? So I guess that's what you're getting at when you say the back of the chest. It's not in the pectoral muscles.
Exactly, and especially because we can get some muscular pain at the back of the chest bone, but the difference of the heart attack and kind of like muscular pain is that the pain is usually like intense and it comes with exercise or activities, but if you take some rest, like few minutes after, if it usually a heart pain should go away. But if it persists there and is associated with, especially with other clinical presentations, as I mentioned, sweating, nausea, vomiting, shortness of breath or difficulty, they need to be taken seriously, especially in people that they had history of heart disease or they have some sort of clinical risk factors of having heart problem.
Let's talk about angina. Is it closely related to heart disease? Is it heart disease? What are the differences?
That's a very good question, actually. Angina or angina is the same kind of painful feeling at the back of the chest bone, which usually comes with exercise or activities. Angina, people with having history of heart disease in the past, they are pretty familiar with this feeling, with this angina, which usually comes when they do activities or when they do some sort of exercise. But not every angina is heart attack. The angina, which is more intense in presentation or severity, it lasts more than usual, and it doesn't go away with taking rest or taking the required medications. is can be serious, and it means that you might be having a heart attack.
Can you give us an idea in terms of number of minutes when you say long-lasting? What would a long-lasting angina attack be?
Especially for patients that they have this history of angina, we always tell them that they need to take rest if they feel like that the angina is presenting. And they always need to have their medications, the under-the-tongue medication, nitro pills, with themselves. They need to take one pill, wait for 5 minutes, another pill, wait for another 5 minutes, and they can also take up to 3. But after 15 minutes, if the heart pain or the angina is not going away, they need to call for help.
Now, what if worst case happens and you're having a heart attack, or you think you are? What should you do?
Actually, that a person who feels that they are going to have a heart attack, they should not drive themselves to hospital or they should not wait. They should call 911 right away, because the paramedics with the ambulance team, they can do a test quickly called ECG or electrocardiogram, which can show if the person has acute heart attack or not. Because if a person has a heart attack, he or she needs to be transferred to the closest hospital possible to get a clot-busting medications or a procedure called coronary angiogram to open up the clogged artery and to save the rest of heart muscle from getting further damage.
What kind of tests are available to predict your risks?
So there are so many tests that we can offer to the patients to evaluate their clinical risk factors, and also the chance that if they have heart issues or they are going to have heart attack. The first thing, of course, for evaluation of any patient is getting a full history and performing a thorough physical examination. But if based on our evaluation, we think that a patient is suspicious to have heart issues or coronary artery disease, we offer them to have some sort of stress tests, such as ECG, treadmill exercise test, or stress echocardiography, which is done by using an ultrasound, and then or other modalities such as coronary CT scan or nuclear stress test. And if any of these tests show that they might have a moderate or large plaque or a blockage in the artery, we offer them to have a coronary angiogram or heart catheterization.
Is there a recommended period of time? First of all, is there an age where you would recommend that even independent of symptoms, or is that always connected to the presence of some sort of symptom?
Usually we tell that all the adult, especially like anybody with having kind of like clinical risk factors such as high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, smoking, all the risk factors, to have periodic risk assessment by their physicians or cardiologists. But usually we said any adult aged 20 or older, they have to have periodic risk assessment at least every 3 to 5 years in order to make sure that they do not have clinical risk factors of heart disease or heart disease.
Okay, so 3 to 5 years starting at a pretty young age.
Absolutely, yes, because you never know if based on your background or your lifestyle situation, you may have some clinical risk factors, and the earlier that you identify them, the easier you can control them.
Well, we have about a minute left, and I'd like to focus on you. What's the most intriguing part of your practice?
So the most intriguing part of my practice is preventive medicine. Basically, as a common scenario, I see a lot of patients with having acute heart attack in emergency departments that they do not do well. But after taking care of them in hospital, when they recover and we send them home in a better situation, the thing is that the story is not finished there. I would follow that patients in my clinic and I would go over all their clinical risk factors in detail and try to help them to identify their risk factors and try to minimize them. Interestingly, after working with them few weeks or few months, the much improved feeling that they have toward their health condition and the progress that they make in order to minimize their risk factors, it's the most rewarding aspect of my practice.
Well, I can see that from the smile on your face.
Thank you so much.
Thanks for that great information. Dr. Samani is board certified in adult echocardiography and nuclear cardiology, and she's highly trained in heart catheterization, coronary angiography, and pacemaker insertion. We want to thank her for joining us, and we want to thank you for watching this segment.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
Welcome to What's Happening at Tri-City Medical Center. Our guest is Dr. Samani, and she's here to discuss heart disease in women. There are significant differences between men and women in the epidemiology, diagnosis, treatment, and prognosis of cardiovascular disease. These should be taken into account in the care of women with known or suspected cardiovascular disease. We'll be covering these differences with Dr. Samani. Doctor, thanks for joining us.
Thank you so much for having me, John.
So how different is cardiovascular disease in men and women in terms of how prevalent it is?
Actually, cardiovascular disease present almost 8 to 9 years later in women. And because the female sex is associated with a longer life expectancy, so in general, women constitute a larger portion of elderly population that they are living with some sort of cardiovascular disease or they die from cardiovascular disease. The other thing is that between age 45 to 65, 1 in 9 women develops some sort of cardiovascular disease, but this incidence increase after age 65, and we have 1 in 3 women that develops cardiovascular disease after age 65. So the prevalence is different.
Well, it sounds, though, like it's a lot closer than most people suspect. I mean, it's overwhelmingly viewed as a men's issue, I think, in people's minds. So that's valuable information.
Exactly. And actually, there are some alarming statistics showing that cardiovascular disease is increasing even in younger females, such as like age 35 to 45.
So what are the differences in the risk of cardiovascular disease between men and women?
Actually, you know, there are still many common clinical risk factors in both ages, such as high blood pressure, diabetes, high cholesterol, obesity, or physical inactivities. But there are some gender-specific risk factors for women, which I go through them briefly. For example, menopause. Postmenopausal state is associated with higher cardiovascular risk disease. The other things, such as pregnancy-related complications, because some women develop high blood pressure or diabetes during the pregnancy. Having history of hysterectomy or removal of the uterus or womb or removal of ovaries in women can increase cardiovascular disease. Also, studies showed that the prevalence of inflammatory disease or rheumatological disease or higher in women, which can be associated to cardiovascular disease. And in general, psychosocial stress, which is a risk factor for cardiovascular disease, known to be higher in women. So there are some gender-specific risk factors for cardiovascular disease in women.
What about the presenting symptoms? Are they different?
They are different. Still, the most common presentations of heart disease is for example, heart attack is having chest pain at the back of the chest bone, which comes with exercise or activities. But even this common presentation could be quite atypical or kind of unusual in women. Women may not present with this straightforward symptoms. They may have a heart attack, but they come with chronic fatigue, nausea, vomiting. And interestingly, sometimes a heart attack can show itself usually with chest pain coming with exercise or activities, but in women, there are some other triggers such as mental stress, sometimes rest, and even sleep can be trigger for heart attack in women.
What about the issue of hormonal therapy with women?
So there are so many controversies about this topic actually, and there are so many studies done to evaluate the effect of hormonal replacement therapy in a woman. There are 2 major clinical trials done on many hundred women to see if hormonal replacement therapy can prevent cardiovascular disease or not. But the answer showed that there's no role for hormonal replacement therapy in prevention of cardiovascular disease, and actually it may produce some harm. So as a result, the American College of Cardiology, or ACC, recommends not to do hormonal replacement therapy to prevent cardiovascular disease, and actually it recommends that hormonal replacement therapy needs to be stopped after heart attack. However, if the risk benefit the benefit outweigh the risk, then it can be taken into account. But the decision of taking hormonal replacement therapy entirely needs to be made by the physician.
Well, if that's problematic as a preventative, what are the preventative actions that you recommend women take?
Actually, I would say the most preventive aspect of cardiology is to minimize the risk factors, losing weight, having more physical activities, trying to control like the risk factors such as blood glucose or sugar or like diabetes, and also try to eat healthy can prevent these risk factors. But in general, I recommend that women aged 20 years or older, they benefit from having periodic risk assessment by their primary care physician or cardiologist at least every 3 to 5 months in order to identify their risk factors sooner and to treat them at earlier stages.
One of the things I think we should explore a little more, because we passed over it quickly, was the issue of pregnancy and heart disease in women. Can you expand on that a little bit?
Absolutely. Pregnancy acts like a trigger. Women that they never had hypertension or high blood pressure before pregnancy, they could develop signs of high blood pressure during pregnancy, which can be actually without any symptoms, but with having a regular checkup or a periodic assessment, the physician, they would figure out that they have a high blood pressure. And this high blood pressure may stay with them after pregnancy, and some of them, they may need to have medication therapy after pregnancy to control the hypertension. So basically, pregnancy is a risk factor which can kind of unmask the underlying high blood pressure in women.
Is it a serious enough issue where you would recommend that women who are considering pregnancy and who have not had a risk factor analysis do so?
Absolutely. I would say we have some pre-assessment before pregnancy, which can be done by the physician to make sure that the women, they are fit to undergo the pregnancy. And of course, evaluating the hypertension and the other related clinical risk factors are part of that assessment.
Well, we have a little more than a minute left, and I'd like to give you a chance to talk about what you think is the most significant issue in the treatment of cardiovascular disease today.
If I want to actually relate them to like both gender, not necessarily women, I would say preventive medicine. I would say there are 3 approaches to look at these interventions. One is mass education of entire population to make them aware of cardiovascular risk disease and also to help them to identify them at earlier stage. 2 is to treat the people who have already some sort of clinical risk factors such as high blood pressure, diabetes, or cholesterol or obesity. And the 3rd is to identify people with established or with cardiovascular disease and try to treat them with lifestyle changes, behavioral modifications, medications, and sometimes with some sort of cardiac procedures or surgeries.
Well, that's great information. I think people will pay attention. You presented it very well. Thank you for joining us.
Thank you so much for having me.
You've been watching What's Happening at Tri-City Medical Center. I'm your host, John Bonosoro, and this series will keep you informed about health issues, events and services at Tri-City Medical Center, and provide you with information for a healthy lifestyle. Watch for more segments in our series, What's Happening at Tri-City Medical Center. And remember, you can see this and all KOCT programs by logging onto KOCT.org. Thanks for watching.